Hi everyone, my name is Dr. Melissa Estavillo and welcome to Biltmore Psychology and Counseling's video blog. For the month of May, we're tackling some of the questions that have to do with what are certain modalities for therapy, what do some of the acronyms mean that you might read about so that you feel comfortable taking that first step. So as always, we'd love for you to subscribe for future content, and you can leave us some comments below and like our video. So the second question that we have is, what is CBT therapy? So CBT therapy stands for cognitive behavioral therapy. For a lot of us, there are places in which we get into situations in which we feel anxious or depressed, and we can see that sometimes our thinking, the way we're viewing the situation, might not be the most rational. So the premise behind this is basically, you might be in a scenario, let's say you're working with your boss, and you're feeling really bad, but you're able to take a step back and realize, hey, I'm making some automatic assumptions about people. I'm having some really rigid standards for myself. I'm really struggling with the core beliefs of who I am. And that is ultimately leading to some distress and some different circumstances that I'm coming across. And so what CBT therapy looks to do is identify what are some of the problematic thoughts that we have and be able to replace them with likely more adaptive, less rigid, less black and white types of thoughts. And then in turn, that lowers a lot of our distress. And so this therapy works really well for anxiety, works really well for depression, like I said. It's one that we typically use in office when we're doing individual therapy with people. And for some of those very cerebral, linear kinds of people that like to be able to see what step am I on, what's the plan, where am I going, what am I doing, this therapy works really, really well, because we can really be able to chart, hey, this is where we're at, these are some of the changes, these are the outcomes that you should be seeing. And so I find that this really works well for some people that really like to feel like they have a firm plan and sense of what they're going into for therapy. So like I said, with a lot of these, that's a 2-second summary on a very complex thing, and so if that didn't make any sense, or if you want more information about it, feel free to leave some of those questions in the comments below and I'll answer those for you. Thank you.